Hi, I'm Rosie Dupont and I'm here to talk to you about my exercise-based program for rehabilitating pelvic floor dysfunction and also combating backache, pelvic pain in general and period pain. So let's have a quick look at what pelvic floor dysfunction actually is. So that can be anything from when you sneeze, you have a little bit of urine leakage, to certain movements will cause a little bit of wee or poo to pop out, or you might have urge incontinence where you need to get to the toilet and you need to get to the toilet now. If you've been doing the traditional squeeze and release or draw up and hold type exercises and they've not been working for you, you're not seeing any improvement, then it really is time for you to look at more of a holistic approach to your symptoms. And in my program and working with me, you will learn that it's how you move and how you're using your body that affects the function of your pelvic floor. Through corrective exercises and learning to use the right muscle groups rather than the wrong ones, and learning how to use your body in the way that it was intended, and learning how to sit properly, stand properly, and to lift and carry your baby, and all the other things that you need to do in life and being a mum, will help to improve the function of your pelvic floor and also reduce the other symptoms of backache, the pelvic pain, and the period pain that you're getting. It's not normal to have any of these pains. It's certainly not normal to have period pain. It's very common, but it's a sign that there is something amiss. And this is the lack of natural movement in our lives, the fact that we're so sedentary all the time. Even if you go to exercise classes, it's what you're doing in between those exercise classes that tell you whether you're a sedentary person or not. And so it's learning natural movements and to change postural habits and lifestyle habits that will really help you to get the function back into your pelvic floor. So if you are wanting to become symptom-free, I would love to work with you, and I look forward to working with you and helping you improve the function of your pelvic floor, your back, and reducing your back pain, your pelvic pain, and your period pain.